Now, another story we're talking about this morning, 2 more hospitals in Sussex will automatically test blood for HIV.
We can be the first country in the world to defeat this awful virus. Let's do it. Let's do it.
That's pop legend and campaigner Sir Elton John, who was in Parliament on Wednesday, urging the government to do more to reduce the number of new HIV cases. And he believes the so-called opt-out blood testing regime might be the answer.
In the UK, new HIV diagnoses are down 46% since their peak in 2015. With all of you here and saying, you did it, we did it. Great Britain led the way in ending this disease.
Now, the scheme works by automatically checking for HIV as well as hepatitis B and C whenever blood is tested. It's been in place in the Royal Sussex Hospital in Brighton since April last year, but now the A&E departments at the Conquest in Hastings and the District General in Eastbourne will also join in. Professor Kevin Fenton is a senior public health expert from Public Health England.
We're seeing really good news in terms of numbers and rates of HIV declining since the past decade, since 2015, year-on-year declines. But, it is still here. We have more than 100,000 people living with HIV across the country and about 4,500 people who are not diagnosed and need to be diagnosed and linked to care to help to end HIV transmission by 2030.
Listening to that is Gillian Dean, a consultant in HIV and genitourinary medicine at the Trust, which runs Brighton's Royal Sussex. Gillian Dean, good morning. Hi there, Gillian. Just tell us how this works. So if somebody came into the hospital and a blood test was needed, what happens?
So I think we'll go back one step before that is to say that the game changer really for HIV is the treatment, which is so effective that now people can live long and healthy lives and they're unable to pass the virus on. So if we can find these last few people, then literally we can stop new transmissions altogether and bring the epidemic to a close. And that is a massive, considering where we came from in the 80s, to see the beginning and the end of such a devastating epidemic, then that is what we're aiming to do.
And that, a lot of people listening now will remember that and the ads that were out at the time and, the fear of the unknown for a lot of people. And to be at this point now is pretty remarkable, isn't it, Gillian?
Well, that's right. And unfortunately, those early days created a lot of stigma and fear. And so people are still afraid of getting an HIV test. And these days, they really shouldn't be. It's just a routine test like a full blood count or a kidney check or anything else. And if it's positive, then we'll start you on one tablet once a day and we'll put it into the background, and you don't really need to think about it too much, every day in, day out. So it's super easy to treat these days. And that's why we need to find everybody who doesn't yet know that they've got the infection, because if they don't know, then they will get sick eventually and they will come into hospital, and then it's much harder to turn things around for them.
Okay, so you've been operating this opt-out system for HIV and hepatitis B and C blood tests for over a year now. What would you say about its impact?
So it's EDs are busy places, but nevertheless, the ED staff have been amazing. And essentially, when they take a blood sample, they take a second sample and send that off to the lab and it gets tested. And so far, we've done about 30,000 extra tests per year. We've done 46,000 altogether since we started in April 2022. And we found 8 new diagnoses who wouldn't otherwise have been diagnosed. So people who would have just got sicker and sicker and then needed to be admitted to hospital or maybe even died. And they've been started on treatment and their future is much brighter. I should say as well that the people we've diagnosed aren't people we would normally see in sexual health clinics or other places where we diagnose people. So they're predominantly heterosexuals, there's females, there's people who've never really thought they've been at risk. But of course, everybody is at risk if they've had unprotected sex. That sometimes it's just one unlucky event, and that's what resulted in somebody picking up HIV. So everybody should be aware of their HIV status. If you don't know your HIV status, you should go and get a test.
Gillian Dean, thank you, consultant in HIV and genitourinary medicine at the Royal Sussex. Also joined now by former nurse and health minister, MP for Lewis, Maria Caulfield. Maria, good morning. Well, going back to your time as a nurse, which you've done for many years, just give us your view on what's happened with this change and the treatment and the diagnostics here.
Yeah, well, you're showing my age there, Danny, because when I was first qualified, you didn't really see people with HIV. You saw people with AIDS because you didn't really pick up the virus until people became unwell, very often really poorly. And people died of AIDS, and we had, hospices looking after people with AIDS. So it was a very, very different time. Now people are diagnosed with HIV. They can be put on medication, as Gillian said, and live happy, healthy lives, not with the fear of passing it on to anyone, can have children. It's just such a game changer compared to where we were, just 10, 15, 20 years ago.
There's one phrase in there which might confuse people a little bit. It's an opt-out system. Just explain that for us.
So people can opt out of having the blood test at A&E. So if you go along and they want to take a range of bloods, they will say to you, we will also do a HIV test. The vast majority of people are very happy with that, but you can opt out of it. But as Gillian says, we are detecting the virus in people who wouldn't ordinarily think that they were at risk. And across the country, in the pilot studies that we've done, we've between HIV and Hep B and C, we found about 2,000 cases that we wouldn't traditionally have picked up until people became unwell. And that's why the government's announced expanding that opt-out programme so that we can have it in more places across the country.
Yes, coming to the DGH and the Conquest as well. And so what would your message be for somebody who might say, having been asked that question, would choose to opt out for whatever reason it would be? What would you say to them about staying opted in?
The benefits are, one, to that individual, because if you have picked up the virus in the past, and it could have been many years ago when you picked it up and the virus is in your system, we could detect viral load, then there is a treatment. It's, people don't die of HIV now. They live with it because we've got the treatment that can eradicate that viral load. But secondly, you will not be passing it on to anyone else. And that's also crucial. So for your family, and getting that message out, there's a benefit to the individual, but we can end the transmission of HIV because you will no longer be able to pass it on to anyone else.
Maria Caulfield, thanks for now. The MP for Lewes, a former nurse and Health Minister, Maria Caulfield, with us on BBC Radio Sussex.